Hey guys, this video is all about the lacrosse ball, QL, and lower back release. So when it comes to the lower back, we're talking about paraspinals, the skinny kind of rope-like muscles that they start all the way at the base of our spine and run all the way up the length of our spine to the base of our skull. And then also the QL, or quadratus lumborum, if you want to use the fancy term. That muscle is a little bit more of a broad muscle. It not only attaches to the spine, but also has attachments kind of at the base of our rib cage here, all the way down, also attaching to the top of the pelvis. That muscle, the QL muscle, can often be a culprit in causing some issues with back pain, hip pain. It often plays tug of war with the psoas, which runs kind of opposite the QL, deep inside our abdomen. So this is actually an excellent way to get some good release from those tense muscles if they are working a bit too hard. This is actually one of my favorites. I probably do this close to every day, especially before I go to bed, just to kind of help release all those tissues. So again, you want to be on a hard surface, something that's not slippery. So if you need to put a rug down or a yoga mat, that's fine. Go ahead and lie on your back, like so. You're going to take that ball. I'm going to roll to one side. I like to start a little bit higher, so I like to start right at that attachment to the base of my rib cage. So I'm going to roll over. I'm going to place that ball right at the base of my rib cage, kind of up against my spine. So it's not directly under my spine, the bony prominence of my spinous process. It's just to the left of it. So if I'm going to do the left QL, it's just to the left of my spine, right at the base of my rib cage. And then I'm going to just kind of lie flat. It's going to feel like you got a big rock under there, because that's kind of what happens. But I'm going to move my arm out of the way so you can see where it's at. You can kind of see it right there. Right? Readjust a little bit. You don't have to keep your arm across this way, though. You can kind of relax whichever way you want. I'm just doing it so you can see, right? So from here, you actually don't have to do a lot of movement with your body. Because it has an attachment to the rib cage, you can actually just work on your breath here. So I will often find a spot, take a big breath in, breathe it out, and as I breathe out, I let myself sink a little deeper into that ball. Once I've sunk a little deeper into the ball, I take another deep breath, but I try and push the back of my rib cage down into that ball. Good. Sometimes I even hold the breath for a second or two, and then release it and breathe it out. I'll often stay here and do about 5 deep breaths in this position to help release that rib cage attachment. From here, you can either shift your body up this way just a little bit. You'll feel that ball roll along your spine a little bit closer down towards your pelvis, right? So then you can basically do the same thing. You might even, at this point, now that you're further away from the ribs, you could kind of shift side to side a little bit. You might feel it kind of clunking over those ropey muscles. The other thing you can do is actually reach underneath there, right? You can see where it's at now. Grab hold of it and actually move it with your hands down a little further. So you basically want to just work your way down your spine, the edge of your spine, until you get to a point where you are just at the top now of your pelvis. So I went from up here at the base of my rib cage to down at the top of my pelvis, still to the side, not on top, not directly underneath, but still to the side of my spine. And same thing. So now I am going to do a little bit more movement, maybe with my hips here, right? I'm kind of slowly rocking back and forth. The QL at this point here, if I remove this for a second, it actually has attachments to the spine and the pelvis, and then kind of wraps around the top of the pelvis here, just like that. So with that ball in that position at the top of the pelvis next to the spine, right, I'll hang out there. And then what I'll often do is kind of shift and rotate my hips so that I can feel that ball kind of rolling along the top edge of my pelvis. This sometimes takes some practice so that you can feel what it feels like. But it's essentially, as if somebody would take their hand or their elbow and just run it right along the top of your pelvis, your hip bones, where you kind of put your hands on your hips. It's right at that spot there. If you find any spots that are kind of sticky, hang out there and you can rock your knee back and forth, just like you've done in the past with the hip mobility. You can straighten that leg out. You can even bring that knee to your chest a little bit. Just anything that you can do slowly and controlled. Right? From there, lift it up. Spend a few minutes on one side, then take that ball, and start it over at your base of your rib cage on the other side. I will actually spend a good 5 or more minutes doing this just before bed to help kind of release the tension from my lower back before I get comfortable in bed. Give it a try and let us know how it goes.